Hi, I'm Dr. Tiffany Denny. I'm a physical therapist, and I'm on my 7th right knee surgery. That's this one. I got cleared yesterday to start weight bearing again. So I thought I'd share how I start that process of putting weight on my leg and starting to progress away from my crutches. It doesn't happen immediately. I'm going to start with my 2 crutches so that I have plenty of support still and comfort. But the trick is to connect my mind back to my leg and start to rely less and less on my crutches. That's the real trick. So I have a few things that I work on to start getting to where I can get rid of one crutch first and then eventually both crutches. So I am actually pretty fresh in this. My surgery was an osteotomy. I did also have a meniscal root repair. And so I don't have a brace. My brace got discontinued. Yours may or may not. Okay, but here we go. So with my 2 crutches, the one thing that I have been doing is totally weighting my other leg, my non-surgical side. And so what I'm gonna have to start doing is putting weight on this leg. Now, personally, the things that really are uncomfortable for me are my foot. It feels weird on the bottom of my foot. My calf hurts a lot, and my ankle hurts quite a bit when I start to put weight back on my foot. So also, it's possible that your knee will hurt, right? Honestly, for me, that's not the primary thing that feels bad. So just things to be aware of and not to be scared of as you start to do this. All right, here we go. So I am going to take my feet about hip distance apart, and then what I want to start to do is weight shift. Now, I'm going to be honest with you. When I weight shift onto my non-surgical side, I really get over there. And when I weight shift onto my surgical side, I push a little bit into that crutch and I don't really get over there. So I'm gonna actually start to go a little bit slower. And I'm gonna start to get over here. Now, the first thing that I notice happens is this side of my pelvis wants to lift up. I'm exaggerating it here, but my hip muscles that push down into the ground are not pushing down into the ground. So one of the things I'm going to do is lean over onto that side, and then I'm going to say, okay, from the top of my pelvis here, I want to push straight down through my leg into the ground, almost as though I was going to make this side of my pelvis go down and this side of my pelvis go up. And you can see I'm actually doing that. And then I'm going to come back off of it. The other thing that I'm doing is firming my thigh like I'm doing a quad set, because one of the things that can happen is your thigh can, your knee can feel like it's going to buckle because it's not used to using your quads. So you can firm your thigh, get over there, and then push from the top of your pelvis down, and then lean off of it. And I'm going to keep repeating it. Like, I'm going to hold it for a little bit just to feel that work, but I'm going to get off it and do it again, because these muscles kind of have to turn on every step, right? So here I go. Push and off. Push and off. Because the things that want to happen are either nothing pushes, and so my pelvis goes up like this. That can definitely be one thing that happens. Or when I start to walk, I take a step and then I tilt over to this side because my trunk is trying to take over and not make my hip work. So those are the 2 things that I'm going to kind of look out for as I start working. Now, once you start to kind of get the feel for that, that's one thing that I do. Another thing that I do is like little marches in place without marching. So I'm going to go knee bend. I'm going to go high up on my toes, because boy, do I need to stretch the bottom of my foot out. Okay. And then I'm going to come back down. Now, as I shift that weight, I'm pushing down through my pelvis to do the same thing on the other side, so that it ends up being a little side to side march. And you might even be able to see that it's pretty awkward when I get over here because my brain is trying to figure out what to do with all of the muscles of my surgical side. But it is going to help me to get this little bit of walking sense, because of course we don't walk like penguins, right? We do a little knee bend. So you got to do a little bit of the penguin action, because that's going to help you get the feel and get confident. But I do want to start getting this like marching sense. And I'm just going to try. Now I can even try and do like a little extra hip situation here. So now I'm actually letting my hip go up and down, and that's just for mobility's sake. And then I can try and not let my hips move. And neither of these exactly mimics walking, but it gives me something as I'm practicing. Okay, so I can do those. Then, as I'm practicing walking, what I want to do is just practice stepping. So my heel has to come down. My heel and my crutches go together. Now I shift my weight. Now remember, we did that push from your pelvis down. We're going to do that because I'm going to put my weight onto that foot as much as I can. Now, eventually, you want to be able to let go of your crutches and feel confident. But at first, you might be pushing more into your crutches as you do this. And then I'm going to step back. Heel, push, step back. I'm not just going to do that forward. I'm going to do it backwards. Toe, lean back, come forward. Toe, lean back, come forward. Now when I lean back, I feel that a lot more than going forward. I'm going to tell you that right now. When I lean back, I'm still trying to push from my pelvis down through my foot to some degree. And I stepped back decently far. You could also step back a teeny tiny amount at first, which is probably what you're going to do. Okay, and go back. Okay, and then as you get more comfortable with that, you go heel, crutches, push into that leg, step through. Heel, crutches, push into that leg, step through. Back, toe, heel, toe, heel. Okay, and I'm going to do this kind of work, and then as I'm walking, you can see I'm really trying to do also the push off with my foot. And doing this toe heel coming backwards helps me a lot, because it kind of forces you to work your muscles through the like push off action. So heel, toe, and then lift the heel and do that little bit of a sense of a push off. Your calf's gonna work here. Your crutches always go with your surgical side. Always go with your surgical side or your injured side, depending on what you're recovering from, I guess. All right, heel, toe, heel, toe. Yeah, so that's what we're doing. Those are some things to start you off. Other things that I like to do are work on sidestepping. So this is actually done best at like a countertop. So obviously for our purposes, I'm not standing in front of a countertop, but if I were, you know, the countertop's lower, somewhere between what I've got right here. But say I can put my hands on this countertop. I'm gonna go wider so you can see. Okay, I've got my hands on the countertop. Another thing that I'm gonna do is step sideways, lean onto that leg, and then try to step the other way. Okay, so a side to side step is really helpful. And a countertop can just be nice, because obviously the crutches are not ideal for this. Right? You can also step forward into the side a little bit, back into the side a little bit. You can play with this, because remember, when you're moving through the world, you are going to be stepping in different directions. So when you're playing with this weight shifting work, you can do it like this. And then of course you can, ideally, again, better with like a countertop, but you can practice sidestepping. And I just kind of move one crutch at a time and I sidestep the other way. And I'm trying to push off the ball of my foot, push off the ball of my foot, ball of my foot to heel when I'm accepting weight over on that side, ball of my foot to heel, push off the ball of my foot, push off the ball of my foot, ball of my foot to heel when I'm accepting weight. Okay? There you go. Those are some things to start you off. And once you're getting really confident with your walking with 2 crutches, and you feel safe, you start to feel smooth, you're not doing the compensatory things of like leaning really hard on your crutches. So if you're leaning hard on your crutches like this, if you're leaning forward like this, you're not ready to decrease, okay? You really got to be basically barely using your crutches and staying upright as you stand onto that leg in order to say, okay, I think that I'm ready to go down to 1 crutch. And then when you're down to 1 crutch, you want to make sure you can kind of do the same thing. Largely stay upright, not leaning hard on your crutch. If you're leaning on this crutch when you're going, you're not ready for 1 crutch. Okay, so work to stay upright and shift weight onto that leg. And that's how you know. And then you can do all the same activities with 1 crutch and get more and more confident. And once you're getting more confident, you're getting a little more speed and fluidity. That's how you might know that you're starting to be ready to go to no crutch. Or you follow the instructions of your doctor and or your physical therapist if you've got sort of a timeline for that. I hope that's helpful. Good luck.